Hi there. For those of you who don't know, my name is Kelly. I am an on-site, in-person medical interpreter, Spanish medical interpreter in Virginia. I've made this video because I'm teaching a class about the mediums of interpretation. Nowadays, everything seems to be moving more towards remote interpretation, and because of that, I wanted to focus the majority of my class on remote interpretation. However, I wanted to go ahead and make this video for anyone, any students, or perhaps anyone who is just interested in how in-person interpretation works. And also to let everyone know that, well, yes, us in-person interpreters do exist. Not all interpretation takes place over the phone or via video. There are real people out there like me every day who go to hospitals, who go to medical facilities, clinics, mental health facilities, and go in person to interpret for patients every day. So to start off with, I wanted to make it clear that I am an independent contractor. So this means that I'm not an employee of, say, a hospital system or clinic. Instead, I work with, dozens of interpreting agencies. I have contracts with a bunch of different interpreting agencies that offer on-site appointments in my area and beyond. Sometimes I do get assignment offers. Even though I'm in Richmond, Virginia, I have gotten assignment offers in the Tidewater area, so it's further down south, as well as in the DC metro area. So that's further up north, for those of you who aren't familiar with Virginia geography. Typically how it works is an interpreting agency that I work for, they receive a request for an appointment. They'll either send me out an email, a text, or through their proprietary platform, an assignment offer. And it usually, if I'm the first person to accept that assignment, I get that assignment. Or in some cases, I express my availability, and then the interpreting agency, through their own process, decides which of their interpreters who've responded that they're available are going to get the appointment. So I keep a calendar of all my appointments, of course, making sure to leave out any personally identifying information of the patients. And on the day of the appointment, I arrive typically 15 minutes early to the facility. And I will, if it's a hospital, typically I will present myself at central registration of the hospital or registration in general at the hospital. I introduce myself as the interpreter and tell the person registering patients the name of the patient that I'm there to interpret for. This is where it gets tricky, because sometimes facilities expect me to know when my patient is arriving, the patient for whom I'm interpreting. But the thing is that I don't know what my patient looks like most of the time. Sometimes I do interpret for the same patients that I've interpreted for before. Some facilities assume that just by appearance, I'll be able to know my patient when they arrive. So I am sure to let these facilities know that they need to let me know when that patient arrives. Sometimes if I overhear someone speaking in Spanish and they're expressing that they're lost, that they don't know what to do, and I'm waiting for my patient to arrive, I might approach them and let them know, my name's Kelly, I'm a Spanish interpreter. I'm here waiting for a patient. And I do not give them the name of that patient because that would be a HIPAA violation. I wait for that person to give me their name, and if they are the person I am there to interpret for, I will then return to the registration area with that patient. Otherwise, I will do my best to help that person, perhaps get them connected with an interpreter, making sure that staff knows that this person is Spanish speaking and needs assistance. From there, now if I'm going to a private practice, a doctor's office, I will pretty much go through the same process, but oftentimes the waiting areas are smaller and I can usually hear the name of the person when they're introducing themselves to reception. And at that point, I will typically walk up and introduce myself as their interpreter for that day. Of course, we try not to engage in those side conversations in the waiting room. Usually I try to redirect patients as best as I can to, if they have any questions, ask the provider. And if they try and mention anything about their appointment, I say, okay, well, we can talk about that once you get into the room. Because part of being a medical interpreter is making sure that, one, you're not giving any unsolicited or even solicited healthcare advice. I'm just an interpreter. It's outside of my role. And two, you never know what comes up in these conversations. So always try and redirect the patient back to who they need to speak to about certain issues. Really setting clear expectations for the patient. Then we will usually go back with the provider, whether it be at a hospital or it be at a private practice. I interpret when the provider's in the room, when the nurse is in the room. I might facilitate some interactions with reception staff if they do not speak the patient's language. Even if they do, oftentimes I hang back, and try and help, because we all know that there are folks who express that they speak a language when their abilities in that language might not be up to par. And I remain in the room as long as there is a healthcare provider in the room. Once the healthcare provider leaves the room, I then leave the room as well. And I usually, if the patient says, well, why don't you stay here? And I usually smile and I apologize and I say, I'm sorry, it's against the interpreter code of ethics for me to stay in the room with you. And then at the end of the appointment, I will accompany the patient to reception if they need to make a follow-up appointment. Otherwise, if it's in a hospital, sometimes I do direct the patient on how to leave the hospital, because, of course, all of the signs are not in Spanish, and it's difficult to find the main entrance or whatever entrance it is that they entered at. Hospitals can be very confusing. And fortunately, I pretty much have a nice little roadmap of all the hospitals in the area in my head. That's pretty much the gist of in-person medical interpretation. Now, of course, these days with COVID-19, yes, even though the CDC says that fully vaccinated folks can go unmasked, because I'm in medical facilities are exempt from that, and I predominantly engage in pediatric interpreting, which means I'm working with a lot of children who are unable to be vaccinated, in which case it makes sense for me to wear a mask. And if I am interpreting for an especially young child, I may wear eye protection simply because it's not unheard of to have a child sneeze in your face. It's happened to me before. Yeah, because in pediatric interpreting, a lot of times, if you're doing physical therapy or occupational therapy or even speech therapy, you might have to get down on the floor with the provider. And then you're at perfect level for a child to walk up to you and do as they please.